I joined the health program at URI to explore the idea of pursuing a medical career, and I've definitely liked coming to this program, and it's opened my eyes, and I've learned a lot of new things about pursuing a health career and the criteria for it and everyone's different experiences. So.
When my guidance counselor brought this to my attention, I really wanted to act on it so I could learn more about what I would have to do in order to become someone in the medical field.
I was kind of interested in physical therapy but wasn't entirely sure.
My family, they're a generation of nurses, like my grandmother, my great-grandmother, my mother. They were all nurses, CNAs, nurse practitioners, and so you can say it's like in my blood.
And I thought it was going to be a great experience to explore just the college life.
I really wanted to learn what I'm going to expect in the medical field, and I wanted to learn different parts of the medical field, such as physical therapy, nursing.
I love the speakers and how they came and talked to us about what we had to do to become become the profession.
My favorite part about the program was definitely talking to the midwife and also taking vital signs. When we went in the lab where the dolls were, that was really cool, seeing them open their eyes, blink, making different noises when you gave them certain medicine, or even the fake baby, that was really cool.
And I like the baby one the most because you can hear the heartbeat and makes the real baby sounds.
My favorite part is how people from different backgrounds all came together in one room and learned different things about the healthcare industry.
My favorite part of this program is the interaction between the professors and the speakers with the kids. I mean, for example, when we were doing immunizations, they gave us hands-on materials such as the needles, and the orange and the saline bottle.
I would say the immunization because it was hands-on, you got to stick orange.
And I really liked how we got the stethoscopes and we got to take their pulses, and we also got to do CPR on it, and I really liked that.
I think all of it was important. There's not one section that wasn't useful and mind-changing.
One thing I definitely learned would be, now I know exactly what I want and how I have to get there, and I just have to keep doing what I'm doing but just 100 times better. So now I definitely I still want to be a midwife, but first I want to be an RN, and then maybe after a few years at a hospital as a labor and delivery nurse, I'll go back for my master's and become a midwife.
I didn't know midwifery was still around, and I didn't know what it was. I thought it was when you go into the homes and you deliver the babies, but she clarified that for me.
There's many things I'm going to take out. For example, the heartbeats, where you take the heartbeats, and what types of heartbeats there are. If a valve is blocked, you'll know what the heartbeat sounds like. Also, you'll know what wheezing sounds like through a stethoscope.
How to get into college and what I have to do.
ER nurses, I don't really think about all the different kinds of nurses. I kind of thought, I learned a lot about different kind of nursing professions, and that was really interesting to me because now I feel like I could either do that, or as I planned before, to be a pediatric neurologist, but I'm kind of leaning towards nursing now.
I learned that nursing is what I really want to do, and that when you're a nurse, you just don't have to do one thing. There's many other opportunities that you can do when you're a nurse.
I learned how to do the vital signs.
I would tell them it's really informative and you should definitely take it if you have the opportunity, because I've learned a lot in the past 3 days that I was here.
There's so many opportunities and there's so many different things you can do in the field, not just, you're not going to be working with the same people, or you're not going to be working with just older people, you're working with babies, anything you want. And also when we're in the dorms, that's such a fun experience. We had a college experience, so now I know what kind of college I want to go to.
A lot of them want to be doctors or nurses, but they don't know why, and they don't know what type. They just say it. So if they come, they'll probably get an idea of what's out there and what they want to do.
I'm one of the only boys in the program, and there are 3 others, and we really bonded. I mean, we would play outside in the field. We would talk about soccer or other stuff. So, I mean, that was a really good part.
First off, I'll tell them that I got to go to college. I got to go to URI for 3 days and live in the dorms because that was amazing. I could try to persuade them, obviously, to join the medical professions, but I will mostly tell them that I had a blast and it was very interesting to learn about the medicinal plants. That was super interesting, but mostly the midwifery was really interesting because I had never thought about that kind of profession for me before.
I'll tell my friends at high school or my colleagues that the program was a lot of fun and it's also informative. You get to learn you get to meet new people and learn a bunch of new things, and you can ask questions about how you can pursue a medical career. And you also get to meet people who have already gone through it, so you can ask them questions about it too. Coming to the program, I still want to be a neurologist or work in pediatrics, but nursing can also be another possibility for me too.
It's worth it.
There are other people with you supporting you into taking a health career, going into a health career, and that you're not alone and you're going to have a lot of support along the way.